Hello everyone, myself Dr. Namrata Vithalani. I am practicing as a physician and intensivist in Surat. In this video, I will give you information regarding what are the indications for initiation of renal replacement therapy in acute care setting, that is in patients with the AKI. So broadly, if we categorize, we can divide the indications into the renal and non-renal causes. So in renal causes associated with the AKI, if we look, there are broadly 4 indications. First is the volume overload. So volume overload, which is refractory to the diuretic therapy, it is one of the indications. So if patient is having symptoms of volume overload and patient is not producing adequate urine, having oliguria, anuria, or even not relieved by some form of ventilatory support such as BiPAP, and associated with the AKI, that will be an indication for RRT. Next is the hyperkalemia. Hyperkalemia associated with the AKI, which is unresponsive to the medical management such as inhaled salbutamol, insulin, soda bicarbonate, and if ECG changes calcium gluconate. So if it is not responsive to medical therapy or is recurrent associated with the AKI, to prevent the life-threatening complications of hyperkalemia, renal replacement therapy is indicated. Next is the metabolic acidosis. Metabolic acidosis associated with the AKI, which is unresponsive to the medical management, that is the soda bicarb supplementation, and oliguria associated with oliguria and urea, typically pH less than 7.1, it is an indication for RRT. Next is the symptoms of uremia, that is uremic encephalopathy or uremic pericardial effusion or pleural effusion. Uremic pericardial effusion, it is usually develops over a period, so it is common in the chronic settings. Still, uremic encephalopathy, it is one of the indication for RRT. So these are the 4 indications. Next, if we consider non-renal causes, so the insult primarily doesn't involve the renal system, such as any systemic condition such as rhabdomyolysis, which leads to the AKI, and associated with other symptoms of metabolic acidosis, anuria or encephalopathy, or associated with the oliguria and anuria, that is an indication for the RRT. Or certain toxin ingestion such as methanol intoxication, not all patients but those with the metabolic acidosis, having visual disturbances, having high NANGAP metabolic acidosis, and have taken more than the lethal dose, that is more than 30 ml, they are candidates for initiation of RRT. Other dialysable toxins such as lithium and metformin, they may need initiation of the RRT. So broadly, hyperkalemia, volume overload, metabolic acidosis, and encephalopathy, if associated with the AKI, either one of them or combination of them in an appropriate clinical setting in patients with the AKI is or are the indications for initiation of any form of renal replacement therapy depending on the patient's hemodynamic status. Thank you.